What type of cancer generally presents with elevated calcium, renal failure, anemia, and lytic bone lesions? A. Osteosarcoma. B. Gastric cancer. C. Multiple myeloma. D. Ovarian cancer. The answer is C. Multiple myeloma. Multiple myeloma, also known as plasma cell myeloma or Collar's disease, presents with lytic bone lesions, blood count abnormalities, elevated blood calcium, and an abnormal paraprotein antibodies which can cause damage to kidneys. Osteosarcoma, while located in the bone, tends to present with a mass visible on imaging. Gastric and ovarian cancer are not associated with any changes in bone, unless due to metastasis. What is the most common malignant brain tumor in children? A. Medulloblastoma. B. Meningioma. C. Juvenile pilocytic astrocytoma. D. Glioblastoma. The answer is A. Medulloblastoma. 90% of medulloblastomas are in pediatric patients. It is the tumor type in 14.5% of primary brain malignancies of childhood and adolescence. Glioblastoma is the most common type of brain tumor in adults and accounts for 52% of all primary brain tumors. Meningiomas are also fairly common in adult populations, accounting for 34% of primary brain tumors. Juvenile pilocytic astrocytoma is a brain tumor of childhood but only accounts for 2% of cases. Actinic keratosis occasionally develops into which skin cancer? A. Squamous cell carcinoma. B. Basal cell carcinoma. C. Melanoma. D. Merkel cell carcinoma. The answer is A. Squamous cell carcinoma. Actinic keratosis occasionally develops into squamous cell carcinoma and is generally removed prophylactically. Actinic keratosis is not associated with development of any of the other skin cancer types listed. Which of the following types of lung cancer is most linked to cigarette smoking? A. Mesothelioma. B. Adenocarcinoma. C. Bronchial carcinoids. D. Small cell carcinoma. The answer is D. Small cell carcinoma. Small cell carcinoma, also called oat cell cancer, makes up 15% of lung cancers and almost always presents in patients with a history of cigarette smoking. Adenocarcinoma is the most common type of lung cancer in patients who have never smoked. Mesothelioma is most commonly caused by asbestos exposure, while bronchial carcinoids are often of unknown etiology. What condition may look like eczema around the nipple but is actually a malignant skin change? A. Invasive lobular carcinoma. B. Medullary carcinoma. C. Invasive ductal carcinoma. D. Paget's disease of the breast. The answer is D. Paget's disease of the breast. Paget's disease of the breast will often present as itchy, scaling, cracked, red lesions around the nipple. The other conditions mentioned are all forms of breast cancer, but all of them originate in tissues deeper to the breast and will generally present without a visible rash, though some skin changes such as redness or dimpling may occur.